from the station that's on your side. This is Channel 7 News Good Morning Arkansas.
Well, most people, when you hear of eyelid surgery, you probably think it's a cosmetic procedure, but it can actually be medically necessary. And Dr. Wade Brock does both at Baptist Health, and he's here along with Lillian Kerr, who has had the procedure. Welcome to both of you.
Thanks for having me.
Your eyes just look beautiful. So we're going to find out how this went for you. But let's talk about this surgery first of all, Dr. Brock, and what it entails.
Sure. Well, eyelid surgery is a very common surgery. It's for patients who might need medical reconstruction, or they might want to improve their appearance with cosmetic surgery. It's a minimally invasive surgery with not a lot of downtime, and so it's very effective to help patients.
What sometimes makes it a medically necessary procedure then?
Well, patients who want medically necessary surgery, they'll frequently report that they're having trouble reading, or they report blind spots in their peripheral vision, or maybe they're bumping their head. And that's a reason enough to look into whether or not they should have medically necessary eyelid surgery.
We've seen some people whose eyelid almost kind of sags or hangs over. Is that one of the reasons?
That is, and that's a familial trait, but with time, age-related changes can cause it to certainly obstruct your vision. Okay,
well, Miss Lillian, it's good to have you. Tell us what was going on with your eyes and why you looked into this.
I had that problem seeing. My eyelid was down halfway over my pupil, and I didn't realize it was that bad until I went to my eye doctor, and they recommended Dr. Wade.
It's amazing. So here's some pictures before, then we're going to show your after as well.
Okay.
So this was I think my mother kind of had a little bit of this too. I was sharing with you. She couldn't put eyeshadow on because was that kind of your first sign?
Yes.
Yeah.
I couldn't do that. I couldn't wear mascara.
Yeah. And then it progressed to where it was impeding your vision. Had you heard of this surgery before?
Yes, I had, but I had not heard of the brow lift that Dr. Wade did. I had heard of the eyelid surgery. That's what most of, but I find that the people that had just the eyelid surgery, it doesn't last. You have to
combine it with both.
Right.
Okay. Talk about what you suggested for Lillian.
Sure. In her case, the brow was in the way where really, if you took excess skin, you could not have effectively improved her vision. So, and she had a history of some dry eyes. So, we agreed to go ahead and lift the brow for functional reasons, and then if cosmetically we wanted to do a little more, we could proceed to the eyelid surgery. So the first surgery was actually just a medically necessary brow lift, and then we came back and did a cosmetic blepharoplasty.
So for everybody, it could be a little different for everybody, right?
That's the key. It's every patient is different, and you have to know enough to just cater what they need to that individual.
What was the recovery like? How long did it take till you felt good again?
Well, I had no pain. It was uncomfortable, but there's not pain. And it lasted about 2 weeks. You know, you use ice packs for the swelling, and there was bruising, but there was not a lot of pain
at all.
No. And it was uncomfortable because of the swelling, and you have to stay home because you don't want anyone to see you like that.
Well, after that couple of weeks and you started going back out, what did your family and friends say?
Everyone thought it was just unbelievable.
Right, amazing.
The difference.
Well, they look so bright and pretty right now. Talk about the procedure for someone coming in and just kind of getting that evaluation.
Sure. Well, we look at what your complaint is. Is it a case of you're not seeing, or is it a case where you want cosmetic improvement? Many patients who want cosmetic improvement say they go by a mirror, they'll walk by a mirror and they won't recognize who's in the mirror, or their friends say they look angry or tired. So we determine, sort of what their goal is. And then we make an assessment, make sure they're safe to proceed with an elective surgery, and make arrangements. I tell patients there's minimal bruising, minimal discomfort, in most all cases. And we like you to go home after surgery and spend a couple of days in your PJs watching Andy Griffith or Seinfeld or whatever.
Sounds fun,
And then after a couple of days you can go places, and just no bending or lifting for about a week.
Okay, and so for someone like Lillian, this is going to last a while?
Oh yes, I think it will serve her well for many, many years.
Very good. Well, thank you so much for sharing your story with us.
Thank you.
Yeah, we appreciate it. Look how bright-eyed she is. Now, we want to tell people, of course, how you can reach Baptist, and this is right there at the Baptist on
on the Baptist campus,
That's
correct?
right.
Okay. KeepOnAmazing.com is where you can go find all the stories of the patients that we feature here on Good Morning Arkansas from Baptist, and you can always give them a call at 1-888-BAPTIST and find out more about it.
Thank you so much, Dr. Brock.
Thank you very
for
much.
telling us about it. And thank you for your story,
Thank
too,
you.
Ms. Lillian.